So today we will be doing two maneuvers for the lower back pain. The first one which we will be doing is the pullover. So pullover is a very powerful fascial maneuver that helps to reduce the tension and which targets the rib cage, the kidneys and your lower back. So it releases lot of lower back tension, it decompresses your intestines, it prevents stagnation, it also improves your digestion and it will improve your breathing function, opens up your rib cage and your lungs for better circulation and improving the breathing. So it is better for, it also reduces the tension that builds up and the restricted fascia which happens over time due to prolonged sitting. So it opens up that restricted fascia area from the back of your leg to the hamstrings, to your glutes and to your lower back. So there is a lower back tension when you are sitting for prolonged periods of time, and when we are wearing so much of a shoe and we are not focusing on opening up our feet and placing our entire feet on the ground, this also helps you to feel more grounded, and this is like mimicking the fetal position. So when you are feeling lots of lower back pain, your shoulder pain, your you have if you have the if you have any restriction in your torso. So what pullover does is that when you are stretching one shoulder and creating more space between one shoulder and the hip, so you're creating and elongating the spine and all that in the torso is all the organs. We are creating more space by breathing and rotating and pinning the fascia. We are allowing the bones to move in the body and accommodate and make new changes and adapt to the new released fascia fascial patterns. So let's get into the pullover. So for pullover, stand with your feet shoulders width apart. Place all your toes and your heel firmly on the ground. Engage your spinal pelvic lock in. That is, you pull in your belly button to your spine. It's like pushing your belly button to your spine, or you want to hold your pee up. So that is the sensation, or you want to pull up your sex organs. So this is spinal pelvic lock, and spinal pelvic lock helps you to maintain a straight and aligned in a straight spine. Now your spine is straight, and now let's get into the movement. So with your right hand, first we will do it on the left side. With your right hand, just go on the outside of your shoulder blade, that is a meaty part where you just, so this is the part outside of your shoulder blade. There is a soft cushiony part there just outside the shoulder blade. You have to pull in, pull the skin up as if you're pulling a string from your glutes up. With your left hand, now lock that in place. With the right hand, lock that place, or like lock that in place over your right shoulder. With your left hand, grab the rib cage on the right side and pull the skin inward. Now both the hands are locked in place. Right hand is locked over the shoulder, left hand is locked on the rib cage, pulling the skin inward. Now slowly turn your head to the left, engage your spinal pelvic lock in, lift your left shoulder to the sky, slightly bend the knees, lift your left shoulder higher. Now breathe in through the mouth, hold, breathe in more, hold, breathe in more, hold it and bring your left shoulder across the body. Bend your knees, push your butt back and bring it to the right knee and breathe out. Exhale. Turn your head to the left. Maintain the grip with your hands. Maintain the tension with your both the hands and breathe in through the mouth. Out through the mouth. In through the mouth. Out through the mouth. In through the mouth. Out through the mouth. Breathe in through the mouth. Out through the mouth. In through the mouth. Out. In through the mouth. Out. Now slowly come on up and unwind. Shake out your hands. Walk or move from side to side if you have space. Or you can walk in a figure eight. So I'll show you how to walk in a figure eight. We are making a figure eight with our feet. So as we make a figure eight, we are balancing both sides of the body with the brain. So this is figure eight, and then you can move again in the opposite direction. So now we are locking in the new changes that we just made in our body by doing the pullover on the left side. So about the results, now I'm feeling a lot more relaxation on the left side. It's like my left shoulder blade has opened up and my left rib cage is having more air, and my left hip is looser. Now let's do it on the other side. Stand with your feet shoulders width apart. Engage your spinal pelvic lock in. Push your belly button to your spine. Okay, now with your left hand, go outside the shoulder blade of your left shoulder and pull the skin up and lock it on over your shoulder. Maintain that grip and the tension over the shoulder. With your right hand, grab the ribcage of your left side of your left ribcage and pull the skin in. Now lock both the hands in place, pull in your spinal pelvic lock. Turn your head to the right. Slowly lift your right shoulder to the sky, keeping your hips in place. Slightly bend the knees. Lift your right shoulder higher. Breathe in through the mouth. Breathe in more. Hold, breathe in more. Hold and bring your right shoulder across the body to the left knee. Bend your knees, squat, push your butt back and exhale. Turn your head to the right. Breathe in through the mouth. Out through the mouth. In through the mouth. Out through the mouth. In through the mouth. Out through the mouth. In. Out. In. Out. In. Out. Now slowly come on up and unwind. Shake out your hands. Now let's walk in a figure eight. Make an 8 as you walk. You'd feel a lot high on this one because it improves your lung capacity. It forces more air into your lungs and improve your digestion. There is a blood flow in your entire torso, lengthening your spine and thereby reducing the lower back tension. So when we are pinning the fascia on one shoulder and we are taking it on the opposite knee, we are creating more space between the shoulder and the hip. So it is going to elongate the spine and also reduce the lower back pain. So it decompresses the spine and your intestines and improves the kidney detoxification, and that is very important because kidneys are our power source of our body. So detoxification of the kidneys will also help to improve the brain clarity and the blood circulation in your body. It will reduce the anxiety and help you digest better. Okay, so this was pullover. Now we'll do another maneuver for the lower back pain, which is which is non-negotiable for me. I do this every single day. This is the bladder torque. So for the bladder torque, it is quite simple and very powerful. Bladder torque it focuses more on the fascia around the bladder. We are releasing the fascia over there because it gets restricted when we sit for long periods of time, or when we have lots of emotional trauma like fear, guilt, or shame. So the bladder holds so much of emotion, it constricts and restricts the fascia over there, and we are not able to hold the pee for longer periods of time. If you if you want to if you cannot you might suffer from bladder incontinence, so you will not be able to hold pee, and you might feel that you have lost control over it. So this helps to balance the entire system of the bladder. So bladder meridians are a lot in our body, but today we will do it on the right over the bladder to release the tension on the bladder. So now stand with your feet shoulders width apart. Engage your spinal pelvic lock in. Hold, push up your sex organs. Now push your butt a little back, and with your fingertips of your right hand just above your pubic bone, you will feel a sponge there. So as you press in, you will feel like you want to pee. So that is the spot. So it is just above the pubic bone. Now push in and twist the skin so that you make a thumbs up. Now bring your hips to the front, and with your left hand you go at the back or the opposite side of the bladder or the back of the tailbone, and you twist the fascia in the opposite direction, making a thumbs down. So right hand thumbs up, left hand thumbs down. Rotate in counterclockwise and push your hips forward, bend slightly your body, lean back, look up and breathe, and slide and move slowly. Breathe in through the mouth, out through the mouth, 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 in through the mouth, out through the mouth. One more, breathe in through the mouth, out through the mouth. Now relax your hands, shake out your hands, walk around or move in your place where your body, we are locking in the changes. So as you lean back while doing the bladder torque, you are creating more pressure here, and there is the movement of the pressure when you are torquing the fascia in the opposite direction and counter rotating it. And then when we are breathing and moving, the fascia around there moves and accommodates to the changes, creating more space. So bladder torque is very essential, and you can do it 2 times every day. You can do it once in the morning and once at night, and you will see the changes that a lot of your lower back discomfort has reduced, your bladder incontinence is reduced, or any issues associating with the bladder will be reduced. So this was the bladder torque, and these two maneuvers are very essential and very powerful for reducing the lower back pain, or not only just the lower back pain, but it works on your entire body by releasing your shoulders, your lats, your chest, your digestion, your opening up detoxification of your kidneys, opening up your hips, and thereby giving the pure sense of physical and mental well-being.